Hi, everyone. My name is Teresa Dunn. I'd like to welcome you today. I have some esteemed colleagues with me. With me today is Colette Williams. She is the Senior Vice President of Strategic Accounts of North America for Penumbra. I also have Katie Leo. Katie is the Senior Director of Client Relations for SG2. And as I said, my name is Teresa Dunn. I'm going to kick us off by asking a couple of questions, and this is going to be very conversational, and we're going to all just get to know a little bit better about the project that we've pursued over the last year that we're all really excited about. So my first question will be for Colette. Colette, tell me about how the project with SG2, Penumbra, and Vizient came to life. What did that look like?
Thanks, Teresa. This is a really fun project for us. So it really came to life after brainstorming with both Vizient and SG2. The goal was to try to build a strong data-driven experience around why a hospital system would invest in new programs or to treat different disease states in a completely new way. The idea was to see if data itself could help make sense of a strong treatment algorithm to ultimately benefit both the patient and the hospitals. This idea fit perfectly into what Penumbra was already focused on, which is patient-first outcomes. The goal for us was really to look at the different disease states and showcase how we can make a paradigm shift on how patients are treated today. The biggest piece of that puzzle is to ensure the best possible outcomes for patient and the health system overall. Our company was founded on treating stroke, and at the beginning, it was a paradigm shift to learn new techniques for both our physicians and the hospital. However, after all these years of work, this is now the standard of care in the interventional community, and we've learned to continue this thought process and think bigger about these treatment options for the best patient outcomes. This approach took time and research. We now find Penumbra taking this approach again to grow the entire space and reach as many patients as possible in this new interventional world. Penumbra has a long-standing relationship with both SG2 and Vizient, and working together from a research-based approach was exactly what was needed at this time to continue to move the field forward. We knew that this partnership would do exactly that.
I couldn't agree more, Colette. We very much value the relationship with Penumbra and the transparency we have around our mutual goals and objectives. I love that we meet regularly with the Penumbra team to discuss opportunities to evolve that partnership in ways that will drive value to our membership and the patients that they serve. I know that during one of our meetings, Penumbra was discussing the shift in the thrombectomy market, and their goal was to enhance the care through the use of that computer-assisted vacuum thrombectomy device. And that discussion led to an idea around leveraging SG2 and their capabilities. And from there, the project just kind of took off. I think right now I'm going to actually pivot over to Katie because Katie's really been instrumental in getting this project off the ground. So Katie, how did we leverage SG2 to launch this project and what did that encompass?
Absolutely. And thank you so much, Teresa and Colette. As we started to design this methodology, we really knew we were doing something different. And I have to say, Penumbra has been an amazing partner for us throughout the process. We knew that Penumbra's competitors and our members weren't doing anything like this. And we knew that if Penumbra had the data and the vision to demonstrate their value, it could really change the conversation. And also paved the way for programmatic change. So what did we do? We have a database within Vizient, and SG2 is part of Vizient, called the CDB, or the clinical database. And it's made up of hospital data that the hospitals provide. And it's used by hospitals to compare and benchmark their performance on things like quality. We can look at variables at hospitals like length of stay or readmissions. And for this project, we looked at a few disease states like pulmonary embolism and where Penumbra's CAVT, or computer-assisted mechanical thrombectomy, was used versus where it was not. And we analyzed some of those differences. So I think, it's a combination story of what we found of a significant reduction in length of stay, which is really exciting. So several days. And significantly higher contribution margin than anticoagulation or thrombolytics, which are typically prescribed. So additionally, a bonus, not only do these patients get out of the hospital sooner, 70% of of PE versus CAVT cases go home after discharge. And that is really important too, because of what we know about the outcomes for patients who are discharged to home.
Well, thanks, Katie. That's really great. Where are we in this process now?
Yeah, so the great news is we have data and outcomes for those data. We're beginning to share with the medical community. We're very focused right now in partnering with Penumbra on a number of abstract and publication submissions, beginning to share the data we've collected with the greater provider community. What we do next is extend the work to hospital systems that are best matched with Penumbra. So the other part really is making the right connections between Penumbra and the hospital systems that they're going to best serve, and ensuring that those hospital systems know this, that it's out there. Ultimately, thinking about new programs and ways in which hospitals can serve their patients and their communities better by working with Penumbra.
So, Colette, how is Penumbra utilizing these project results and the data to engage health systems across the nation?
The project results are a good start, which is what Katie mentioned. This is the one reason why we have a lot of leverage to move to new treatment protocols. At Penumbra, we've looked at several different options, one of which is the PE study that Katie mentioned, and it has super strong analytical outcomes. And we thought it'd be most appropriate to start discussing this one first, especially because we have an abstract that just got approved for this information to be presented at the VIVA conference. The retrospective study that Katie mentioned included 515 patients in each arm, but it's important to understand that that's 2,060 patients with a full one-to-one propensity matching. What that means is we're actually comparing like patients. In this study, we looked at 4 arms of treatment: CAVT, or computer-aided vacuum thrombectomy, mechanical thrombectomy, lytics, and anticoagulation. This is a total shift in thinking, and we have to get to the right people at the right time. The project results, as Katie mentioned, are a good start of why to treat in a new way. This study was outcome-based analytics from the treatment of intermediate PE. What we uncovered was the use of CAVT had a reduced length of stay, reduced complication rate, reduced in-hospital mortality rate, reduced acute kidney injury, and an overall reduced procedure cost. Katie mentioned that meant that there's a significant shift in a higher contribution margin for your hospitals. We also found that most patients treated with CAVT also had an increased chance of being discharged to home, which helps with an overall reduction of hospital cost. In conversations with the providers that we've shared this information with so far, the PE results are the most compelling. But right now, PE seems to be a hot topic. And again, this is a business perspective, not a physician perspective. But you also know that there's more and more happening in the interventional space. That is, the VTE holistically is a hot topic. Penumbra's not just stopping with one study, but we're rather exploring more and more ideas to make this shift and an algorithm change based on data. And we're going to continue to look at this universe from a different perspective. We also know there's a high focus on how to treat these PE patients, especially these intermediate PE patients. Ultimately, they're very sick and they could die, but these patients also could have a really high cost burden for the hospital. We have to look at a solution on how to balance that with this new shift in thinking.
Colette, that's all great. And I'm thrilled that Penumbra has leaned in and worked so closely with us on this project. There's a lot of folks on the line today, and they're from different organizations across the United States. What is your take on how they could participate in something like this with us in the future?
Thanks, Teresa. I think you said it perfectly. You really have to lean in. As an organization, you need to make sure that everybody involved at your organization is on board with this. This wasn't just one department working together with Vizient and Sg2. This was several departments working together and thinking differently. We even had to pause through this project and think bigger as we continue to look at the data over and over. And I think that's a huge component of it. We also had to not be as focused on the end result, but really walking through the project in the right way and looking at the right way to serve both the patients and the hospitals in the end. We also know that this is just the beginning. We can't just stop with one project. We have to continue to look at this data and make sure that we're looking at it in a fair and true way to come up with the correct outcomes to influence those going forward.
Katie, did you have anything to add from SG2 perspective?
I do. I would absolutely agree with what Colette just said. And, I think Penumbra sort of sets themselves apart in the way that they want to innovate and do things differently. And I think that what we've learned so far is we can keep learning and we can keep going and doing things differently and finding new ways to succeed together. And that's maybe my message out to other members, because it is really a powerful way to go to market.
I just want to say thank you very much to both the Penumbra team and the SG2 team. And thank you so much, ladies, for participating with me today. And I look forward to continuing this journey.